Welcome back. For the past 60 years, the folks at Pediatric and Young Adult Medicine have been serving Metro families. They offer everything from routine checkups to sports physicals to even hospital care. And here to tell us more about that is Dr. Julie Saxton. Hi.
Hi, good morning.
Good morning to you. 60 years is an amazing track record for any business. Tell us a little bit about what makes your organization so special.
Well, one of the things that we're particularly proud of is our 60-year tradition of caring for children. We have 5 clinic sites now located in the East Metro. We started with one office in St. Paul. Because we've been around 60 years, we are now caring for great-grandchildren of people who were our patients.
That's quite remarkable, and as I say, quite a track record. You talk about your clinics having a small feel, but the technology gives you a lot of advantages. Elaborate on that a little.
We are proud of being a small clinic. At this point, we are a private practice. All of the physicians own the clinic, and we are able to make decisions about care and what we offer based on what we choose as best medicine for our patients. We are small and we know all of our families, but we are current on all the technology. We were one of the first small clinics in Minnesota to adopt electronic medical records over 6 years ago, and we have maintained that and brought that to the forefront. One of the things that makes us really unique is we're connected by all of our office sites. Whichever clinic you need to go to, we can access all of your records at that time.
There's also the possibility that if I were to call in, I get to talk to a doctor. That's very rare. Usually, even in most medical situations, you may get in touch with a nurse to help you.
That is probably the single most distinguishing factor that sets us apart from all other private practice groups in the Twin Cities. When you call our clinic, your option is to speak with the doctor, and it gives you the doctor's direct line, and it rings straight to the doctor during the office hours.
How many doctors do you
We have 10 groups in our 10 physicians in our clinic.
Okay. You talk about something called having a medical home for your child. Tell us what a medical home is and why it's important.
We believe strongly that a medical home for children is crucial in this day and age where there is availability of urgent care at Walmart and Target and CVS drugstores, which fulfill a need for working families. It is extremely important to have one person who knows your child and knows your family and knows your circumstances. When you have well child care, it's nice to have the person know your child from birth to age 12 to age 16. But if you have a child with special needs, it's critical to have someone who understands all of the components of their care to bring about the best result for them.
Well, and I know in my own family with my own children, it's nice to have that thread because it gives them, the child, a lot more comfort. When they go to the doctor, they know who they're going to be seeing, they're familiar with the surroundings, and it makes it just a better experience overall. Talk about the well care schedule. What are we looking at taking our children in for over the years?
Immediately after discharge from the hospital, a newborn is recommended to be seen in the first 3 to 5 days after discharge. So we see newborns right at the time they're born in the hospital, immediately after they're discharged. And then we see them for the routine care that's recommended by the American Academy of Pediatrics. 2 months, 4 months, 6 months, 9 months, 12 months, 15 months, 18 months, and then beginning at age 2, yearly.
So they really get grounded in being checked on regularly, and that always gave me as a mom a lot of confidence knowing that things were progressing as they should. You have in your title this young adult medicine. When do you consider our children young adults?
Well, part of that's a developmental question that would beg you to look at the child itself. Typically, adolescents, 16, 17, 18, like to be considered young adults as opposed to adolescents, although technically they are still teenagers. We will see people up to age 21, and probably about 10% of my practice is young women ages 18 to 21 who are still looking for continuity of care and someone who they know and knows them.
Yes, it's very comforting, as I said, to come in during those times to someone that you know. Well, it's a pleasure to meet you. Thank you for stopping by.
Thank you so much for having me.
Continued success with this practice. It's an amazing track record.
Thank you.
For more information about pediatric and young adult medicine, you can call 651-227-7806 or go online to pyam.com, and we'll wrap things up when we return.